Hello, and thank you for joining me today. If you're a woman in your 60s or beyond, I want you to know that what we're about to discuss could be one of the most important conversations you'll have all year, especially when it comes to your body, your vitality, and your emotional health. My name is Dr. Lisa Perriera. I'm a board-certified physician with over 30 years of experience caring for women just like you. And today, we're going to talk about something that has been kept in the shadows for far too long: the impact of intimacy, particularly self-intimacy, on a woman's health as she ages. Let me begin with a story. A few months ago, I received a message from a former patient's daughter. Her name was Eleanor. She'd always been vibrant, sharp, and full of warmth. One morning, her daughter found her in her favorite chair by the window, tea still warm on the table, knitting in her lap, the sun on her face. She looked peaceful, but she was gone. The cause officially natural causes, natural. But as someone who had reviewed Eleanor's declining health over time, I saw something else. Eleanor's vitality hadn't been taken by sudden illness. It had slowly, quietly slipped away due to years of physiological neglect, especially in the area of her pelvic and emotional health. And Eleanor isn't alone. Every year, thousands of older women experience a similar silent unraveling. Not because they're doing something wrong, but because they're told explicitly or implicitly that they're no longer supposed to nurture a part of themselves that was once considered vital, their intimate health. For decades, women have been led to believe that desire has an expiration date, that pleasure is something we grow out of. But here's the truth I want you to hear. Maintaining a connection to your body through whatever form of healthy, respectful self-touch you feel comfortable with is not only natural, it's critical. This isn't about promoting indulgence. It's about preserving circulation hormone balance and emotional well-being. When a woman stops engaging in any kind of sexual activity, including self-pleasure, especially after menopause, her body doesn't simply pause, it begins to change. Tissue health hormone levels, muscle strength, and mood can all decline. The most common thing I hear in my office is, "Why didn't anyone tell me this? That's why we're here." In this video, I'll walk you through 4 medically recognized consequences of completely stopping self-stimulation in later life, and more importantly, what you can do to prevent them. These aren't theories or fads. They're rooted in science, and they're backed by years of clinical experience with thousands of women over 60. So please stay with me until the end. The last point I'll share is perhaps the most emotionally impactful and least discussed, and it may help you understand yourself in a new way. If you're listening and this topic resonates with you, I invite you to like this video, leave a comment below, and subscribe to this channel. At Elder Care Wellness, we believe women deserve honest, compassionate conversations, especially when it comes to aging. Now let's begin with the first, often most overlooked consequence: the gradual loss of vaginal and clitoral function. I want you to imagine your muscles. What happens when you stop using them for weeks or months? They weaken. They lose tone. They shrink. And the same concept applies to the tissues in your pelvic region. Your vaginal walls and clitoral tissues are highly vascular and sensitive, meaning they rely on consistent blood flow and gentle stimulation to remain healthy. According to the Mayo Clinic and North American Menopause Society, when these tissues go without arousal for extended periods, particularly after menopause, they can lose elasticity, become thinner, and produce less natural lubrication. This condition is known as vaginal atrophy. And for many women, the first sign isn't dryness or discomfort. It's a fading of sensation, a loss of pleasure, sometimes even pain during intimacy or while sitting. These aren't just symptoms of getting older. They're physical signals from your body that it needs attention and care. I recall a patient, let's call her Carol, who came to see me at age 71. She was visibly anxious. She told me that she hadn't felt comfortable down there in years, And when she did try to re-engage with her body, the experience was distressing and painful. She thought something was wrong with her. But Carol wasn't broken. Her body had simply adapted to disuse. Just like a joint stiffens without movement, vaginal and clitoral tissues respond to inactivity by becoming less responsive. The good news: in many cases, with gradual reintroduction of gentle stimulation, use of vaginal moisturizers, and in some cases, guided pelvic therapy, sensation can improve. But only if you catch it early. What saddened me most about Carol's story was how many years she spent thinking this was normal, that she just had to accept the change. You don't. Even light, respectful forms of arousal a few times a week can promote circulation, preserve elasticity, and maintain the health of this important system. And it doesn't need to be elaborate. Simple, consistent care can make all the difference. Now let's talk about something even more foundational to your health, your hormones. Most people associate hormonal changes with menopause, and that's fair. Estrogen, progesterone, and testosterone all shift significantly during those years. But what many women don't realize is that intimacy, especially orgasm, can have a lasting effect on your hormonal landscape even decades after menopause. When you experience arousal and release, your brain responds by releasing a powerful blend of hormones and neurotransmitters. Oxytocin, often called the bonding hormone, fosters feelings of calm and connection. Dopamine boosts mood and motivation. Endorphins reduce physical pain and emotional stress. These chemicals work together to create a state of balance and vitality. Now imagine going years without triggering that cascade. In my practice, I've met women who came in complaining of sleeplessness, irritability, sadness, or a sense of emotional flatness. They had tried supplements, changed their diets, even started antidepressants. But when we explored their daily lives more deeply, one pattern stood out: a complete absence of intimacy. One woman I'll never forget was a retired school principal. Her voice cracked as she told me, "I just don't feel like me anymore." And the truth is, she wasn't imagining it. Without the natural hormonal reset that arousal can provide, many women experience heightened stress, reduced resilience, and even increased symptoms of depression and anxiety. This doesn't mean that pleasure is a cure-all, but it is a powerful natural support for your brain's chemical balance. And it's never too late to reactivate that pathway. Whether through gentle exploration, mindfulness-based intimacy, or self-guided practices, you have the ability to maintain your neurochemical wellness. This is not indulgence, it's a medical tool you carry with you every day. In Part 2, we'll go even deeper into how pelvic floor function and emotional resilience are directly tied to your body's intimate rhythms, and why ignoring them can affect everything from bladder control to your sense of identity. But for now, take a moment to reflect. Functioning well, your pelvic floor allows you to control your bladder, have healthy bowel movements, support your posture, and enjoy sexual intimacy. But when it weakens, everything from your independence to your confidence can be affected. Here's what most people don't realize: regular sexual activity, including self-pleasure, is one of the most natural, effective ways to keep these muscles engaged and strong. During orgasm, your pelvic floor contracts rhythmically. It's like a workout, except instead of lifting weights, your body is engaging those deep, stabilizing muscles through natural movement and reflex. When that stimulation disappears, so does the opportunity for those muscles to stay toned. I've treated many women who first come to see me because of bladder leakage. Some are in their late 60s, others in their 80s. Often they've stopped going to their favorite social events, taking long walks, or traveling, all because they're worried about finding the nearest bathroom or experiencing an embarrassing accident. They assume it's just aging. But age isn't always the root cause; muscle disuse is. In fact, studies supported by the National Institutes of Health have shown that regular pelvic floor engagement, whether through specific exercises or healthy sexual function, helps reduce the risk of urinary incontinence and even pelvic organ prolapse. Let me tell you about Joan, a kind and spirited 74-year-old woman I treated a few years ago. She was sharp funny and loved crossword puzzles, but she hadn't left her house in over a month. Why? Because every time she laughed or sneezed, she leaked. After a physical exam and a compassionate conversation, we realized her pelvic floor had weakened significantly. She hadn't engaged those muscles in years, not through exercise, and not through any form of intimate stimulation. And she had no idea that something so private could be so directly connected to her everyday freedom. With a personalized program that included pelvic floor exercises, hydration, and yes, the reintroduction of gentle self-intimacy, Joan regained her confidence. Within a few months, she was walking with friends again and planning a trip to visit her sister out of state. You deserve that kind of freedom too. Maintaining your pelvic health doesn't mean you need to follow a strict regimen or pursue anything that makes you uncomfortable. But staying connected to your body in ways that feel good and safe to you is part of keeping your independence, especially as you age. Now I want to shift to something even more personal. Something I've heard whispered in so many private conversations with my patients, the emotional disconnection that can slowly creep in when intimacy fades. It's subtle at first. You stop engaging with your body, perhaps because of discomfort, or just the belief that those days are behind you. You tell yourself it's normal, your mother never talked about these things, your friends rarely bring them up. And besides, what would it change? But over time, that disconnect doesn't stay isolated in one part of your life. It starts to affect how you see yourself. Women have shared with me that they no longer feel feminine, that they avoid mirrors not out of vanity, but because something feels missing. They describe feeling invisible in rooms they used to light up. They stop laughing as loudly. They hesitate before reaching out to others. And more than anything, they feel alone sometimes, even in a house full of people. There's no lab test for this. It doesn't show up on a scan. But its impact is real. Intimacy is about far more than physical pleasure. It's about identity connection and vitality. According to the Cleveland Clinic and other leading institutions, regular intimacy, especially when paired with emotional self-care, can help regulate mood, reduce anxiety, and preserve cognitive function. Here's why. Your brain responds to touch and arousal with a release of neurotransmitters that promote well-being, like serotonin, which stabilizes mood, and oxytocin, which reduces feelings of isolation. These are not just feel-good chemicals. They play an essential role in keeping you emotionally resilient and mentally sharp. When these signals are missing for long periods, the effects can mimic or even worsen depression, especially in women who are already navigating major life transitions like retirement, loss of a spouse, or health changes. Let me share the story of Gloria. She was 69 when she came to me. Widowed for nearly a decade, she had built a quiet, structured life. She was eating well, walking daily, and volunteering twice a week. But emotionally, she told me she felt like a shell. I smile for everyone else, she said, but inside I feel grey. Gloria hadn't touched her body in years, not out of shame, but out of habit. She had simply stopped. Together, we worked on rebuilding a gentle sense of body awareness, starting not with physical pleasure, but with basic relaxation and emotional self-touch, like hand over heart or deep abdominal breathing. Slowly, she began to reconnect. And that reconnection didn't just revive her emotionally, it reawakened her sense of purpose. She started taking art classes again, dressing with more flair, even laughing more fully. She told me I feel like myself again for the first time in years. I share these stories because I want you to understand something vital. Intimacy is not about indulgence. It's about maintaining the chemical, physical, and emotional systems that help you feel whole. And you don't need a partner to start. A gentle practice of self-care, whether through breathwork, pelvic health exercises, or yes, mindful self-touch, can spark a quiet but powerful shift in how you feel about your body, your day, and your place in the world. In part 3, we'll talk more about the specific methods and practical strategies you can use to preserve and even restore intimate function in your 60s, 70s, and beyond. This includes safe, medically recommended ways to reintroduce stimulation, strengthen your pelvic floor, and support your hormonal health without medication. But for now, I hope you'll take a deep breath. Place a hand over your heart, and remember this. You are not done. You are not broken. And you deserve a life that still includes pleasure, connection, and joy. Because your health isn't just about your heart rate or cholesterol. It's about how deeply you feel alive. Now that we've explored why staying connected to your intimate health matters physically, hormonally, and emotionally, let's talk about what you can actually do about it. Because here's the encouraging news. Even if it's been months, years, or even decades since you've engaged in any form of self-intimacy, it's never too late to begin again. The human body, especially the female body, has a remarkable ability to respond to care and attention no matter your age. Let's begin with the foundation: blood flow. As we discussed earlier, your vaginal and clitoral tissues are made up of delicate blood vessels and nerve endings. Just like your legs or hands, these areas need healthy circulation to stay functional. When you go too long without stimulating these tissues, that circulation slows. Over time, this can lead to thinning, dryness, and even a loss of sensitivity. But you don't need to jump straight into anything you're not comfortable with. For many women, the first step is simply gentle reintroduction. Start with something as simple as a warm bath, soft music, or moisturizing with a pH-balanced vaginal cream. Over-the-counter options like vaginal moisturizers or vaginal estrogen creams, if approved by your doctor, can help support elasticity and hydration in the tissues. And remember, this is not about pressure. It's about permission. You are allowed to explore your own body with kindness. You are allowed to do so slowly. Even placing your hand gently on your abdomen or over your heart as you breathe deeply can begin to re-establish that sense of connection. Over time, if and when it feels right, you might begin exploring light touch using your hands or a safe, gentle device designed for older women. Devices with low vibration settings and soft edges are often more comfortable and effective for stimulating blood flow without irritation. You may also want to try incorporating a water-based lubricant. According to the North American Menopause Society, this can reduce friction and discomfort during self-touch, making the experience more enjoyable and safe. The key is consistency, not intensity. Even engaging with your body once or twice a week can make a difference in maintaining nerve responsiveness and tissue health. And when your body feels cared for, your mind often follows. Now let's talk about strengthening the muscles you can't see, but you definitely feel when they're not working well: your pelvic floor. These are the muscles that support your bladder, bowels, and uterus. As you age, hormonal shifts and inactivity can weaken them. But the great news is they respond beautifully to movement. Kegel exercises are the most common and clinically proven way to improve pelvic floor strength. If you're not familiar, here's how to try it. 1. Imagine you're trying to stop the flow of urine midstream. That gentle squeeze, that's your pelvic floor activating. 2. Hold that contraction for 3 to 5 seconds, then release. 3. Aim for 10 repetitions 3 times per day. If you're not sure you're doing it correctly, don't worry, you're not alone. Many women benefit from a consultation with a pelvic floor physical therapist. These trained professionals can guide you through gentle techniques to engage those muscles safely and effectively, often in combination with breathwork and posture correction. And as we mentioned earlier, orgasm itself causes rhythmic contractions of the pelvic floor. So when you engage in self-intimacy, you're naturally strengthening those muscles, enhancing circulation, and supporting bladder control without ever setting foot in a gym. Now let's return briefly to hormone health. While estrogen, progesterone, and testosterone naturally decrease with age, that doesn't mean you're powerless. Regular sexual activity, even self-stimulation, has been shown in studies published in journals like Menopause and Climacteric to support natural hormone regulation. That's because the brain responds to arousal and orgasm by releasing hormones that promote relaxation, connection, and mood stability. It's a feedback loop. The more consistently you activate those pathways, the more likely your body is to maintain its ability to produce and use those beneficial chemicals. For women dealing with chronic anxiety or mood shifts, adding this kind of natural hormone-supporting routine, even just 10 minutes a few times a week, can make a subtle but powerful impact. But beyond biology, there's another benefit that's just as important: ownership. When you take time to care for your body in this way, you're sending a message not just to your cells, but to your spirit. A message that says, I still matter. I still deserve pleasure. I still belong in my own skin. I once worked with a 76-year-old woman named Denise. She had been widowed for 15 years and hadn't considered self-touch since her husband passed. Her health was fine, but she felt numb, emotionally disconnected from her identity as a woman. Through gentle encouragement, education, and emotional support, Denise began exploring her body again. At first it was uncomfortable, not physically, but emotionally. She had to overcome guilt, grief, and decades of cultural messages. But after a few weeks, she told me I didn't realize how much I missed myself. That single sentence says so much. Because this is not just about preventing dysfunction or boosting hormones. It's about self-recognition, reconnecting with the parts of you that may have gone quiet but are still very much alive. So where do you start? Here's a simple weekly routine you might consider as a gentle re-entry. Day 1, 5 minutes of breathwork with your hand resting over your lower abdomen. Day 2, a warm bath with relaxing music and mindful touch. No agenda, just presence. Day 3, Kegel exercises while seated or lying down, 3 sets of 10. Day 4, moisturizing your vaginal area with a doctor-approved product. Day 5, optional light self-touch with lubricant or a device if comfortable. Day 6, rest and reflection journal, meditate or speak affirmations aloud. Day 7, repeat whatever felt most meaningful that week. Even if you only do half of this, the consistency is what matters. And remember, nothing here has to be done alone. If you have a partner, a therapist, or a trusted support network, include them. Your health is worth sharing with those who respect it. In Part 4, we'll bring everything together and talk about the most silent but most life-changing impact of all, how this private decision affects your identity, your relationships, and your sense of meaning. Because the truth is, this is not just a medical issue. It's a deeply human one. And you deserve every chance to feel alive inside and out. We've talked about biology, hormones, and muscles. We've talked about circulation, mood, and even daily routines. But as we close this conversation, I want to go deeper into the heart of what this really means. Because what's at stake here isn't just physical health. It's your identity. Too many women in their 60s, 70s, and beyond quietly begin to feel like they're fading. Not because they're sick, and not because they've done anything wrong, but because they've let go of something essential, their sense of aliveness. Over the past 3 decades, I've sat across from hundreds of women who have said some version of this, "I don't know who I am anymore." or I feel invisible, or simply, I miss me. And when we start to unpack those feelings, it rarely comes down to a medical diagnosis. More often, it's the result of years of disconnection from pleasure, from confidence, from self-touch, from joy. From the very parts of themselves they were taught to suppress once they hit a certain age. It's understandable. For generations, women were told that after menopause, intimacy was no longer necessary. That a graceful woman, more importantly, so does lived experience. I once worked with a woman named Margaret. She was 81. She came to me not because of pain or medical concern, but because she felt like she'd disappeared. Her husband had passed years ago. Her children were grown. She had a garden, a book club, and a lovely group of friends. But as she told me in her own words, I feel like I'm living from the neck up. She wasn't depressed. She wasn't ill. But something was missing, and she knew it. We talked about body awareness, about breath, about gentle reconnection. And for the first time in over a decade, Margaret began exploring her physical self again, not for performance, not for anyone else, but as a quiet act of healing. 3 months later, she told me, Dr. Perriera, I don't feel young again, but I do feel real again. That moment stayed with me. Because when a woman reconnects with herself, she becomes more than just healthier. She becomes whole. This is not indulgent. It is deeply restorative. It can restore your posture, your sleep, your relationships, your voice. Women who begin to care for themselves in this way often begin to speak up more, laugh louder, wear colours again. They walk differently. They meet their own gaze in the mirror. That's not vanity. That's vitality. And it's within reach. If you're still reading or listening now, I want to leave you with this. There is no age at which you are supposed to give up on joy. There is no birthday that makes you less deserving of pleasure. And there is no expiration date on your connection to your own body. You are not invisible. You are not past your prime. You are not done. You are evolving. You are adapting. And you are allowed to thrive. So if you've felt distant from yourself lately, I invite you to begin gently. Run your fingers through your hair. Place your hands on your chest as you breathe. Moisturize your skin slowly. Whisper something kind to yourself. Touch your own cheek like someone you love. This is how we come back. And if intimacy feels like a far-off goal right now, that's okay. Reconnection isn't a race. Every small act of self-respect, of self-attention counts. As we wrap up this series, I hope you feel encouraged not just to understand the science behind your body, but to honor the spirit within it. You have a right to feel good in your own skin. You have a right to pleasure that is gentle, respectful, and affirming. You have a right to age with not just health, but with warmth and wholeness. And if today's conversation stirred something in you, if it reminded you of a part of yourself that's been quiet for too long, I hope you'll let that part speak again. Because she's still there. She's still you. If this series helped you feel seen, I invite you to share it with a friend, a sister, a daughter, or anyone who might need to hear that it's not too late. Not too late to reconnect. Not too late to feel. Not too late to begin again. Thank you for trusting me with this conversation. Please subscribe to Elder Care Wellness for more thoughtful, evidence-based guidance on women's health after 60. And if you feel moved, leave a comment below, sharing your thoughts, your questions, or simply that you're still here, still growing, and still honoring your body with love. Take good care of yourself. You deserve it.